circulation here. Also very good treatment for low libido, low sexual desire. You can add, instead of kidney 7, you can do kidney 2, 4, 7. This will work well as well. But kidney 7 is okay, it's enough. So, what have we learned so far? Digestive. Person with digestive problems, you don't go here. You stay on there. This is the digestive corner. This and this. Okay? Two treatments for gynecological disorders. One is hormonal and one is pure gynecological, assembled by merging two patterns, Jue Yin-Yang, pericardium kidney Yang Ming, and hormonal. Also, Shao Yang Shao Yin for those who tired, depressed and tight. I will tell you how you can distinguish these two patterns using the pulse diagnostic system of Jimmy Chung. This was right and this is left. Let's talk about left Guan. Left Guan, if Guan is strong and it's up, it's definitely Jue Yin Shao Yang people. It's too much of ego, it's too much of fight. And at this point, I look at the tongue, and in the tongue, sides usually red. So it's liver heat, but it's more emotional. The real problem of liver is when the pulse is deeper and tight, very tight. And there are some other pulses of liver that we will study during the pulse diagnostic course. Sometimes we feel the left Guan. Sun, Guan, and Che. And you feel that the pulse is quite deep and you can't feel the borders of the artery. What it means? It means that this is damp heat. That was pure heat. But here we come to damp heat. It's still strong, it's still pounding. That's fatty liver, but pounding. They still belong to this pattern, Jue Yin Shao Yang. Another situation is when you want to feel this pulse and your finger drops into the muddy kind of jelly structure. It doesn't rebound. It's so soft and weak. There is no strength, there is no fire, there is no heat. Usually these people belong to Shao Yin Shao Yang pattern. They are depressed, they are frustrated. This is a pulse of frustration actually. It's quite different from weak, tense pulse of liver when it's like this. When you find in left Guan high on the top, it's usually Jue Yin-Yang Ming pattern because it's more deficient. That can be weak, that can be strong, but it will be too high. Pericardium, liver, Yang Ming. So with pulse diagnostics, you can easily find not only the right channel to balance when you do the local balance, right channel to needle, but also you can choose the right pattern. It helps enormously because with pulse diagnostic you can clearly see the which Zhang Fu organs are involved, what's going on in the body. And that's an amazing diagnostic tool to help us to read through the body conditions, as well as the ear diagnostics. So we will talk about it during the pulse and ear diagnostic course. However, I included in our manual for Zhang Fu patterns the ear diagnostics as well.